I'm very excited to be speaking to you today in the pre-lunch spot, so hopefully you can all bear with me here. And I'd like to start out by telling you about one of the people that I care for in my cardiology practice. And so this is a 59-year-old man, and he has high blood pressure, high cholesterol, and a sedentary lifestyle. And he's been having chest pains on and off for the last 2 weeks. So he goes into his doctor. The doctor says, I think we should get an EKG, gets an EKG, has some very concerning findings on it. We whisk him away to the cath lab. He gets a stent implanted in one of his coronary arteries and gets a whole new medication regimen prescribed to him. And as he's getting ready to leave the hospital, he asks us, he's like, well, what more can I do to improve my health? And so we told him that he could attend cardiac rehabilitation. And cardiac rehab is a program of exercise training and health behavior counseling for people with heart disease. And it's strongly recommended for people after a heart attack or a stent placement, after cardiac surgeries. And it's even recommended for people with chronic angina or chronic heart failure. And typical programs include 36 sessions that are usually about an hour long over 12 weeks at a hospital or clinic-based center. And it's a multidisciplinary program. So it's doctors, nurses, exercise physiologists, psychologists, dietitians providing this care. And we know that cardiac rehab improves outcomes. So people have lower hospital admissions by about 20%. It reduces cardiovascular mortality for people with ischemic heart disease by about 25%, and it improves people's quality of life. All right, so that all sounds great, but what's the problem? So when we take all the people who are eligible for cardiac rehab, and then we look at who we actually refer to cardiac rehab, we see that we are missing out already on an opportunity here. And then when we look at who actually enrolls in cardiac rehab, we see that it's only about 16% of the eligible population actually enrolls in cardiac rehab. And then going even further to who actually completes the full 36 sessions that we know are associated with the greatest benefit, it's even fewer. So we have this huge gap in the delivery of cardiac rehab, where we have all of these patients who are eligible for this treatment who are not receiving it. And so I think that there is tremendous opportunity for improving the use of cardiac rehab. And because cardiac rehab improves outcomes, improving its delivery will improve health. And so what are some of the barriers to cardiac rehab? So there are a lot. We kind of divide them generally into health system barriers and patient or perhaps person-related barriers. And I can't tell you about all of them today. But a lot of them basically boil down to the fact that it's hard to get people to go to a cardiac rehab center 3 times a week for these hour-long sessions that are not in their home, not in their community. And this patient that I told you about earlier, so he didn't go to cardiac rehab the first time around. He lived an hour away from the nearest cardiac rehab center, and he was still working. And so it was just not feasible for him to go to cardiac rehab as part of his life. And we need to find ways to make cardiac rehab more convenient for our patients. And we actually know that home-based cardiac rehab programs are equally as efficacious as facility and center-based cardiac rehab programs. We just don't do them. And so here, I think, is where we have an opportunity for technology to help us provide cardiac rehab in the home and community setting. And so we asked the question, can technology improve the delivery of cardiac rehab? And so if you're an informaticist, the kind of fundamental theorem of informatics is, can the person plus the computer or device or digital tool or whatever you want to call it, can that improve things over just the person alone? And so we're asking this question for cardiac rehab. So there are a lot of digital tools that you can use for cardiac rehab. I think immediately people think of wearables and sensors and fitness trackers, but you can even dial it back a little bit. Can you use text messaging to nudge people to do behaviors like with cardiac rehab? Outside of the US, in Europe and in Canada, there are web-based home cardiac rehab programs. The American Heart Association has developed an app called My Cardiac Coach, which helps coach patients through self-management after a heart attack. And then there are a lot of other things that people are experimenting with in this space. So there are many programs that are starting to do hybrid programs where they deliver video-assisted home cardiac rehab in addition to their center-based cardiac rehab. There are some fitness centers and gyms that are doing smart programs where you have a little fob and you check in with your device and it gives you your exercise prescription on your treadmill and then records how much you're actually doing. And then there are companies that are developing platforms for delivering cardiac rehab at home, where there's a patient app and then there's a provider portal for sort of interacting with the patient. So there's a lot of opportunities for these digital tools in cardiac rehab. And so what is some of the evidence that we have for using these digital tools in cardiac rehab? I often get asked the question, is a tracker enough? And the simple answer is no. There have been a lot of studies looking at just using a tracker, just using that passive data collection and then displaying that number to you. Is that enough to actually make you change your behavior and adopt healthy behaviors in the long run? And the basic answer is no. But we do see evidence that if you couple something like a fitness tracker with other health behavior interventions, as we heard a lot about this morning, that this can actually be effective at getting people to change their behavior and hopefully sustain that over the long term. And then looking at another space, so looking at text messaging. So this was a study conducted in Australia, and they looked at the effect of text messages in patients with heart disease. And they randomized people to either usual care or to getting text messages 4 times a week for 6 months. And the text messages were based on health behavior theory and were based in evidence. So they vetted all of these with patients before they actually created this intervention. And they found that these theory and evidence-based text messages actually resulted in improvements in cardiac risk factors. And interestingly, in this study, they also found that people who received the text messages who also happened to go to cardiac rehab had 7 times the odds of being physically active. And so there may be a synergistic effect with combining multiple different interventions here. And another study, also done in Australia, looked at using smartphones to deliver cardiac rehab. So they had traditional center-based cardiac rehab on the one arm, and then the other arm was people receiving home cardiac rehab. So there was an actual person helping to provide the home cardiac rehab, interacting with people over the telephone. And then patients had smartphones that delivered the intervention. And the mobile group had better participation, better adherence, and better rates of completion of cardiac rehab than the traditional group. And what was most important about this study is that they showed that they did this with similar improvements in efficacy. So similar exercise capacity improvements, similar risk factor reductions. So even though they were able to reach more people, get more people completing cardiac rehab, they weren't doing it at a decrement in the benefit. And so we've kind of looked at a lot of this data around digital tools for cardiac rehab and have thought about what's important to think about in this space. And so we do still think that it's important to address the core components of cardiac rehab, because interventions that are based on a theoretical understanding of behavior are more effective. We do think that these should be rooted in behavior theory. There's a strong sentiment from a lot of these studies and a lot of the development work that you see that you need to have individualization. 10,000 steps is not good for everybody. These things need to be usable. If people can't use it, it's a challenge to get them to use it once, and it's a huge challenge to get them to use it multiple times. And then we do also think that it's important that it should improve patient or person-centered outcomes. And that may be experience, but that also may be other things like exercise capacity or symptoms or hospitalizations or mortality. And then in this space, it's always important to demonstrate efficacy in a well-designed study. And then we've also come to look at these tools and realize that it's very important to study implementation in the clinical setting, because it's one thing to give people an app and then ask them to use it, and then it's another thing, as you've heard multiple times today, to give them something that they can actually use within the provider's clinical workflow, and then give the patient something that they can use that becomes a habit that's part of their daily life. Oh, well, you got a preview. So I work with the VA, and the VA is developing a whole suite of apps for patients. And one of the apps that they are developing is called VA Fit Heart, and it is a mobile app that's supposed to be used for cardiac rehab. And this VA Fit Heart app allows patients to do goal setting. It allows patients to log their physical activity and other health measures. It does have some brief health education modules, allows them to set reminders as a nudge, and we've kind of designed it to work as part of a home cardiac rehab program. And the VA Fit Heart app sends us data to the VA patient-generated database, and the VA patient-generated database has a store of data that can then be viewed by any of the VA apps, so not just by VA Fit Heart. And one of those other VA apps is an app we call CR Pro, which is the provider-facing piece of this picture, and it allows the providers to view the patient's goals, view the patient-generated data, and then basically create a note that goes into the electronic health record. They receive workload credit for it, et cetera. And so it can be part of their, an integrated part of their workflow. And all of this is still sort of in early phases, so I don't have a whole lot of data to show you. But I think as we go through this whole process, we see that for all of these digital tools that many, many questions remain, and I could probably add 90 things to this list from this morning alone. But as people keep bringing home, it's really important for us to understand how we can actually use these tools to help people feel healthier and improve their life. And we need to be able to demonstrate the real benefit of this. And there are challenges that remain in terms of figuring out how to do that, and then also in terms of getting paid for it. So to go back, all right, it's a little buggy. So go back to the patient I told you about. So he had another heart attack. Between his first heart attack and his second heart attack, he had thankfully moved. And so now he is closer to a place where he can go to cardiac rehab. And he's attending cardiac rehab, and he's also participating in our studies on how to use digital tools for cardiac rehab, which is a good thing. And my hope is that we can go from this current model where we're really not reaching very many people who are eligible for cardiac rehab to a future model where with digital tools we can reach many, many more people and improve their health. And I'd like to acknowledge all the people who have helped with all of the work that we've been doing. And I think we do have a little bit of time for questions if there are any.
Have a couple of minutes for questions? Yeah?
Yeah.
This is really great. I really enjoyed that. The model that I'm used to seeing in Europe, coming from Europe, is actually family-based cardiac rehab.
Right.
And maybe could you say a little bit about how digital might play out in the context of a family-based rehab program, both from a rehab and then also a primary prevention perspective?
Right, so I think there's a lot of things that digital can do, and the VA is actually pretty interested in caregiver work too. So there's a lot of interest in family and caregivers, and so I think that digital, is a platform for communication. So like one of the big deals in home cardiac rehab is just that they spend the first 15 minutes of their telephone home visit like exchanging data, and that's just ridiculous, right? So it's really just a platform for communication. So it's a platform for communication between the patients, can be a platform for communication with their caregivers and their family, and can be a platform for communication with the providers. And so, at least in my mind, that's how I'm sort of looking at that whole space. But certainly, bringing family and caregivers into the equation is very important. Yeah.
So I noticed when you put up on the slides that there was a VA app store. Is
Yes.
that how the VA patients get access to the different?
So yes, and I will caution you, it's like still very early. So there's not too many apps that are available, and they are actually available only to veterans because they are linked to the veterans' electronic health record. It does require that you have that sort of authenticated to get in there. So it's not like one of these things where everybody can just go Google this and download the apps right now. So anything that does link to the electronic health record is sort of only for veterans at this point. But there is an app store that veterans can go to get these apps. Yeah.
Thank Great job.